Good day, I'm Dr. Susie Avise, and I'm here today to talk to you about the challenges of diagnosing the 11 million autoimmune connective tissue disease patients we have in the U.S. CTD is not easy to diagnose. There are overlapping symptoms, disease waxes and wanes, and over half of patients are misdiagnosed. A study of 8,000 patients showed that earlier SLE diagnosis led to better patient outcomes and less burden on the healthcare system. Plus, an LFA survey says it takes an average of 6 years to get an SLE diagnosis. So how can we do a better job diagnosing earlier and more accurately to help more patients? Well, the complement system has been linked more intimately to SLE than any other human disease. And complement activation, the key part of the disease process, happens prior to tissue damage. So if you can measure complement activation more accurately and earlier, you can have a better indicator of disease. Historically, doctors have used soluble C3-C4 to measure the presence of SLE. However, C3-C4 levels can be misleading and inconsistent because other issues can impact levels such as hereditary factors, low disease activity, etc. The exciting news is that there is another technology, cell-bound complement activation products, or CBCAPs, that can provide a more consistent and accurate measure of disease. CBCAPs are products of complement activation. When complement activates, C4D fragments are produced and stably bind to the surface of circulating cells, forming cell-bound complement activation products. This bond allows the C4D to attach permanently to the cell, leaving a fingerprint of disease presence. For SLE, we measure erythrocytes and B cells bound to the complement activation product C4D, creating EC4D and BC4D biomarkers. CBCAPs were discovered after 15 years of research and have been validated by the top lupologist in the U.S. as a measurement tool for better diagnosis of SLE. These lupologists conducted one of the largest published SLE validation studies with approximately 800 subjects, demonstrating that CBCAPs delivers a 22% increase in sensitivity over soluble C3-C4, a 48% higher sensitivity than anti-dsDNA, and a 33% higher specificity than ANA. CBCAPs are exclusively available as part of the Avise CTD diagnostic to help physicians and their patients accurately and consistently rule in and rule out SLE. With a single blood draw, Avise CTD is a convenient and effective way to help address the challenge of diagnosing CTD, RA, and SLE. It all starts with early and correct diagnosis. To learn more and see if Avise testing can help you, visit avisetest.com or call us at 888-452-1522.